You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers, or what my first guest calls full mouth reconstruction. He says your teeth are never too far gone or too bad to be able to have the smile you've always wanted, be able to eat and chew whatever you want. We're talking about full mouth reconstruction today. With us, we have Florida's go-to dentist, Dr. Reinol Gonzalez. Dr. Reinol, welcome to the program.
Thank you, Randy.
Now, they call you in your practice what? Dr.
G.
Dr. G.
Yeah.
And then your wife is a team.
She's Dr. I.
Dr. I. And now your son.
He's coming in. He's going to have to be Dr. RJ because he's not going to be Dr. G, that's for sure.
So is this all you do? You go home, you guys talk about dentistry?
Pretty much. Pretty much.
Well, good for you. Now, and we should mention also that the things we're talking about today, you also are on the lecture circuit. You teach dentists the things we're talking about today.
That's correct.
Is that right?
That
okay,
is
good. So for people that don't know your center, because you kind of pride yourself in kind of doing everything under one roof, who's your typical patient that you see that's for full mouth reconstruction?
I mean, the typical patient is just somebody who's been, years with all types of issues with their mouth, broken teeth, cavities, swollen gums, loose teeth, all types of things, and they really don't know that they have options. They go to some places that supposedly give you a choice, and all they want to do is just take all the teeth out and do that type of treatment. And when they come to me, I tell them, look, the first thing we have to do is a comprehensive exam. Let's look at everything. Let's see what we have to work with.
Because you say you want to save teeth when you can.
Absolutely. There's nothing better than your natural teeth. Your natural teeth give you a feel that you wouldn't have if you have implants or anything that's solid. Your teeth have these nerve endings that give you some feedback as to what you're doing. So
as far as eating and chewing.
Absolutely.
Interesting. Okay.
Yeah. So we definitely want to save your teeth if we can. Using a multitude of procedures, we can restore your mouth and give you a full mouth reconstruction and give you back that smile that you wanted and be able to eat the foods that you want. Chew on an apple, chew on steak.
So your office, I mean, because we talked, you do things very quickly there.
Yes.
It's because where typically you would go to a specialist for this, or an endodontist for root canals, or a prosthodontist for this. But you do it all right there, and you have your own lab. So you don't even have to send things out.
Absolutely.
Is that why you're able to do it so quickly?
Absolutely. This is something that over the last approximately 8 years, I've been developing that because I saw a need for that. For the years that we were doing these big full mouth reconstructions, they were difficult to get done, and the patients had to go through a lot. They had to sometimes suffer through it. Now,
like going through a lot, meaning back and forth to the lab and different stuff.
Correct. And having to wait for things. The biggest thing was time, because if you send it off to a lab and then they take 2 weeks to bring it back, and then it keeps going back and forth, especially in the bigger cases, you have to do this multiple times. Now I have all the lab in-house.
You have computers that actually make teeth right there.
Yes, we do.
Like 10 of them or something.
Yes, we do. We have the big thing today is 3D printers and mills, and yes, I have.
You have all that stuff.
I've got 4 mills. I've got 10 printers. We can do pretty much anything. The one thing that we don't like to do is dentures, removable dentures. We want to save your teeth, so that's the one thing that we don't do. But everything having to do with fixed, we do in-house and fast, because we have it all there. I have a technician there. If we need to change a color or something, we can do it right then and there. We don't have to send it off to get it done.
So you brought some photos. What are we looking at?
We're looking at a few of these cases. For example, this is Monique. Monique came to us. She had some health issues that unfortunately it makes her mouth real dry. It caused her to have a lot of broken teeth and decayed teeth. She had been to multiple places to try and get this repaired, and they were just doing the wrong thing. They kept patching things, and she wasn't convinced that she was having the right treatment done. So she ended up at another dentist that eventually referred her to me.
Okay, good.
To get this treatment done. And she was really happy when she did. She tells me now that I changed her life, and like I keep telling her, no, I didn't do it. You did it, because you came here and you let us take care of your mouth and your smile. So through multitude of procedures, we ended up with something that now, in the picture that you have, you see her smiling in the in the before picture. That's not her normal. We asked her to smile. We asked her to exaggerate her smile so we could see her
So
teeth.
they don't smile.
Not at
typically.
all. Not at all, because they don't want to show what they have.
Just smiling with the mouth closed.
I mean, would you want to smile if you had your
That's a good point.
that condition? So she wouldn't smile. Now she doesn't stop smiling.
This is really good.
Yes.
She's got to be happy about that.
She's ecstatic. She goes out now and she tells people, people tell her, "Oh, you got such a beautiful smile," and she just tells them, "Well, yeah, Dr. G did them." She doesn't say that it's her natural teeth. She's not afraid now to tell people this was done by Dr. G. So this is one of my favorite cases. We just actually finished her up recently, the last couple of weeks.
When they look at the mirror for the first time, what's that like?
It's amazing. In this particular case, after having such a young person come in with her teeth all destroyed like they were, when we delivered her temporaries, not even her finals, and we gave her the mirror to see what it looked like, which the temporaries looked almost as good as the finals, she basically started crying. We all started crying. My whole staff started crying with her because it was emotional. She's young, and now her first thing was, wow, I can't wait to show my kids. So immediately she actually got on FaceTime with her daughter. That's
to show her.
Yes, absolutely.
Because you say she's like 39 years old.
She's 39 years old. And
couldn't wait to show her daughter.
Oh, it was awesome. It was an awesome experience for me. There's a type of that's kind of the reason why we do this. We love to feel like we've done something for somebody. And it just feels great when you have these kind of results. So, I mean, Randy, tell me, when you look at her before picture, and compare it to the after picture, wouldn't you say she looks more educated, more refined?
Yeah.
Definitely happier.
More attractive, for sure.
A lot more attractive. So the smile, absolutely, it makes her more refined, more educated, and it makes her just look so much more attractive. And that's true for all these cases that we do, regardless of if you're 80 years old, 40 years old, man,
just
female, whatever it is. A smile looks better. Smile looks
That's
great.
nice. And you did all this. You didn't have to send these out. It's all right there.
Everything was done in-house.
So it's like an extreme smile makeover, full mouth reconstruction right here.
Absolutely.
Okay, good.
Yeah. So here we have, Alvaro. Alvaro, nice guy. He's in construction. And he just came in, and again, his thing was the smile. He couldn't smile. Well, obviously, if you look at his pictures, at his before pictures, he's missing some teeth. On the lowers, he had a broken teeth, decayed, all types of things. And in his case, it was also about function. He's a big guy. He likes to eat, but he couldn't eat. Okay. So for him, it was, what can we do? We started off, we got him done, and now he was just in the office just 2 days ago, and he was telling me, "Doc, I can't believe it. I can actually eat steak now," and I'm like, "Well, that's what this was for, right? In your case." And I go, "No, but I also like to smile." And he's Latin, so he only speaks Spanish, but Spanish, the Latin community has a way of, or the Latin culture has a way of expressing themselves a little bit more. So
the personalities change. Like you
Totally.
fix their smile, and they become like a little bit different, or who they used to be. Maybe.
Absolutely. He talks more now. He's more engaged with the staff. He's not just quiet, just getting treated. No, he just comes in and he walks in the door now smiling. It's no longer coming in, because again, a lot of these before pictures that you're going to see here, they're smiling only because we asked them to smile. Okay,
they don't like
but
to
they
smile.
normally don't like to smile. I've got one patient here that will show you that her before picture, she just wouldn't smile.
Let's take a look. Let's take a look.
So this is Jacqueline.
Okay.
This is your typical case of somebody who comes in.
So that's her
and
smile.
That's her smiling. She just wouldn't smile, and we kept asking her to smile. When we do this treatment, part of the technology that we have is these 3D facial scans that we do, so that when we do everything on the computer, we can create that smile based on your face and on how you smile. Well, she wouldn't give us that smile. So when we gave her first set of teeth, I ended up wanting to make some changes because we didn't have a smile beforehand, But this time when she looked in the mirror, she gives this big smile and she's like, wow, And then I said, okay, stop right there. Let's get the facial scan, So now we got the facial scan that I needed, and then we were able to perfect the teeth even more.
So the reason, as a cosmetic dentist, full mouth reconstruction, but this scanner is like a 3D scanner.
Yes.
That measures and does everything to fit the smile to their face. Is that what it helps you do?
Well, what it helps me do is it gives me a 3D image of her face with a smile, okay, that I can place into the design software, so that when I place the teeth the way they're going to be made, I can see what they're going to look like in the mouth, not just not just in the air somewhere.
Now we had a discussion in the green room, but you were saying people with bad teeth are judged, and this full mouth crowd, as you say, some of them haven't been to the dentist in 20 years. So when you say they're judged, elaborate on that. People with bad teeth.
Well, it's easy. I mean, just look at the movies. When they want to show somebody who's low class or poor or just
like a street person,
just a street person or homeless, what are they going to show? They're going to show somebody with bad teeth. It's the smile and the teeth. It's amazing what it does for you. So. And typically those people have bad teeth because they haven't been able to take care of their mouth for whatever reason. But that's what when we see somebody with bad teeth, that typically tells us this is uneducated, poor, and they're not attractive. As soon as you change that, as soon as you change the smile with the type of reconstructions that we do, that just changes their self-esteem.
Makes it feel better.
Oh, totally.
Because you and your wife both said, you don't judge. Like when somebody comes in with really bad teeth, it's like moving forward, what are we going to do?
Absolutely not. I mean, I have one gentleman here that I did that again was referred to me by another dentist, because I have a lot of other dentists that refer for these type of cases to me.
Like the complex stuff.
Yes.
Okay.
And he's a wealthy individual, been in business all his life. He's done great for himself. And his teeth were just a disaster. But he finally got the time, here's the person that just blames it on time.
Okay.
He finally got the time to get it done, and then he didn't realize how fast it was going to be, which was part of the problem that stopped him from doing it before.
But you see a lot of them have big regret.
Absolutely, and the regret is that he didn't do it sooner, okay? He waited so long to get it done,
Is it the fear? Because look, I was watching television. One of the wealthiest guys in the world, his bottom teeth appear to be kind of like rotted out. Is it the fear of the dentist? Or they don't get how it's noticeable it is?
That's a big part. A big part is fear of the dentist. I mean, you don't know how many times
nobody likes going to the dentist.
Nobody likes going to the dentist. And the comment that I get almost every single day, Doc, I don't like the dentist.
Like no offense.
Nothing personal.
Nothing personal.
But I don't like the dentist,
Do you have a one-liner come back?
No, I just tell them I don't like them either, but hey, I have to live with them. Once they start going through the treatment with us, they realize, wow, it wasn't that bad, and a lot of them have just been through bad experiences, and you can't blame them for that. It's just that's what they've been through, so they don't know any better. Okay.
Yeah.
They finally reach that point, that breaking point where they say, I have to do something about it. So, I have people that come to me from all over the place. I had one gentleman recently that drove all the way from Tampa, which is basically 4.5 hours from me. And, in the consult, I'm like, why did you come to me? There's so many good dentists in Tampa. And I know a few.
Okay.
And he's like, I don't know, Doc, but, I saw your reviews and I saw what you do, and you're the one for me, and now he's ecstatic.
You're everywhere online, by the way.
Yeah, I try to
Google.
be.
And it's kind of an affordability theme, and that's
Yes.
because I guess you do it all right there.
Well, yeah, doing it all in-house, which is one of the main reasons why I brought everything in-house, was because I'm big on trying to bring that cost down. I know dentistry is expensive. Or at least it's thought to be expensive. People don't realize how inexpensive it really is. But the bottom line is I've been wanting to bring that cost down, and I started finding solutions to do that.
Okay.
I brought in all this equipment. I brought in the right people to
You have
do
lab
everything in-house.
workers that work there too that make the teeth?
I have people that just do that. That's
Okay.
all they do is the lab work. And then what I've done is, I pass that cost savings on to my patients. It's not just about me making more money on that one procedure. I pass that cost savings on.
So you do like wisdom teeth, you do
Yes.
root canals. It's all right there.
Everything's in-house. Everything's in-house. I've got, some doctors are better than others at different procedures, so I have the right doctors for each one of those, but in-house. I don't have to send you anywhere. Everything gets done right there. So let me show you this gentleman. Here's a good case. Eduardo here. He came to us actually about 4 years ago. He came to us, and you can see his teeth were all broken up in the front. Really nice guy, and I guess his fear of the dentist just kept holding him back. Then about 6 months ago, I think he saw something on Facebook, or he saw something that reminded him of us, and he came back in. Okay, and this time he's like, "Doc, I'm ready," and I'm like, "Okay, but we got to re-examine you now. We got to see where you're at now. It's been a few years. Let's see what's changed." And a few things had changed, but bottom line, again, we were able to go ahead and solve his problem. And now he comes and he's like, again, he's ecstatic. He's one of those that for him, it was more about the function than it was about the eating. Yeah, exactly. Being able to eat, being able to bite into an apple. I mean, if you look at his front teeth in the before, there's no way he could bite into an apple. He can't, exactly. You can't even see him. So for him, it was about being able to eat.
So a combination of procedures.
And we get to the point where now, not only do they look great, and you can see just in his smile, in his before picture, he barely smiles, even though we're trying to get him to smile. In his after picture, you can see that now he's smiling, but he's smiling because now he can eat. That's what he thinks. From the day that we finished his teeth, with that combination of things that we do, from that point to now, it's been about 5-6 months. I think he says he's gained about 20 pounds. And he's actually happy about it.
Okay, good. That's the most expensive part about this, is going out to eat. Single tooth implant, I have this question. So if you're only missing one tooth, why a dental implant over a traditional bridge?
There's several reasons. First of all, if you have a single missing tooth, and you have teeth on either side, a lot of doctors, they take the easy way out and they will cut those teeth down to go ahead and put a bridge, right? Okay. To bridge them across. Well, I don't like the idea of damaging healthy teeth just to replace one. And that's where a single implant is ideal. I even have one for a single tooth. When you lose teeth in the back, all the way in the back, which some people, I don't see it, okay, so I don't need to replace it. Well, that's when the way your teeth come together, it starts to collapse, your smile starts to shrink, let's say, and then you start looking older and older. So that's another reason why you want to replace.
So the teeth in the back, I guess, are for chewing.
Correct.
And and there's 20 million people, according to Google, that have upper lower denture.
Yes.
And I think you've even told me that that's where it starts, like with those teeth in the back, or missing one tooth and 3 teeth and 4 teeth. It's kind of a snowball.
Absolutely, because you're missing the teeth in the back that you use for chewing. So you start using teeth further forward. You start beating them up, and then you start losing those. And it keeps going.
Just by missing teeth in the back?
Just by missing teeth, absolutely.
So you're putting a couple of implants and
you can solve that problem.
And you could stop that.
Absolutely.
What about cost, though? What costs more, the bridge or the implant?
Well, if in the long run, it's a lot less to do an implant, okay? Because you only do it once. You don't have to remake this bridge as it fails. But even when you look at just straight cost, okay, it's about the same up front, so it's a lot cheaper.
It's just that people hear the idea of surgery and they get afraid,
right?
Because it seems very painful.
Well, I'm glad you brought that up, because in the way we do it, because of all the technology that we have in our practice, and it's one of the things that I teach other doctors how to do, is a thing that we call guided surgery. And because we do the implant placement using surgical guides, all that means is that I have pre-planned the case. I have pre-planned the position of the implant. Okay. Therefore, at the time of surgery, I don't have to do as much digging around and figuring out where I'm going to put this implant. It's already planned. So the treatment is quick.
Just kind of pop it in there.
It's very quick, and just pop it in, put it in place, okay? And most patients, when they're done, they're saying, "That's it, okay? It didn't hurt, doc." And I'm like, well, It shouldn't, but this is
So pain is not something they really complain about.
Never.
But they're numbed up when they go to you. And
Absolutely.
You guys you're big on sedation, right?
Yes,
You're
we
doing
are.
a lot of that.
We do that, especially for those patients that need to do a lot of dentistry and they don't want to take as much time off, so we can do more dentistry in one sitting than having to do it over multiple visits. Okay. So yes, sedation is big for that.
Okay, good. I'll let you. You have time for a few more photos.
All right. So this is Nicole. Nicole came to us. Again, she had been told. Actually, she had been told that there was not much that could be done for her. She has a combination of issues with her teeth and her bone and the shape of her jaw and all that. And so after examining her and after doing all the, using all the technology I have in the office, we were able to come up with a treatment plan that ended up with the results that you see in the after pictures.
Very nice.
And she's, again, now she's ecstatic. She's even done a testimonial video for us because she's just so happy with what she's been able to achieve. You look at her before, and she just, the transformation was such that now
she's got to feel good about herself.
She feels awesome about herself. She's really happy, and she even brought her sister now to have treatment done because of
now
the
the partners, husbands, wives. One gets it done, then the other gets it done. Do they ever do it together? Like these extreme makeovers?
They do, and it's unfortunately I didn't bring their pictures, but like I just had a couple just 2 months ago that I did husband and wife. They both came in. Actually, the wife is the one that came in for the consult, and because she thought she was more advanced and more had more problems, so they came in with their daughter that to translate. And the husband decided he wanted to do the consult as well. So we did the consult for him as well. And next thing you know, the following week I'm doing the wife, and the week after that I was doing the husband. And we got them both done. And again, they're both ecstatic now. They're both smiling, and they're both very happy.
So if I go to your part of Florida and see a couple with perfect teeth, it might be them.
It might be them.
So, well, good for you. And now, look, we should mention insurance. Even the best dental insurance only covers a very small part of this.
Right.
Medicare, Medicaid doesn't really cover it. But you say people finance procedures now routinely.
Absolutely. And that's something that we pride ourselves in, that we have a lot of financial options for our patients.
You have to have decent credit, right?
Yes, to get the better rates, just like in anything.
Okay.
The better the credit, the better the rate, the better the terms, everything will be better if you have. But it doesn't mean that if you have bad credit, you can't get it done. We have a way of financing everybody. It doesn't matter who you are. We have a way of doing it. Okay.
No more excuses.
No more excuses. I pride myself in having found all the right companies and all the right plans to be able to get you covered. Okay. Because again, like you said, insurance just doesn't do anything for you, even if you have it. Some people say, "Oh, well, I have my insurance." No, it covers maybe a little bit of a small portion of what needs to be done.
Because it's very tough. People call, obviously want a diagnosis over the phone and the cost.
Right.
But you do a free consultation, because I guess that's where it starts. You got to get an exam to give them an exact price.
That's correct.
Is that fair?
That's fair. And in my consultation, I believe I do more than others, because I will actually take a panoramic X-ray, which gives me an overall picture. If I have to do a CT scan, which some doctors will charge $300 for, I'll do it for free, part of that consult, because I want to know what I'm working with, and I want you to know whether you want. And every time we see this, the patients immediately go ahead and book for their.
You have a big team, by the way, too. I saw on your website. It's like it's like this wide of people.
24 team members. Yeah.
That's good. That's good. Yeah. And they, of course, everybody always says their team is great and this and that. But you told me on the phone you wanted to make sure that you mentioned that you have a great team. They all love what they're doing.
They all love what they're doing.
Why does that matter?
And I love my team. I mean, I know this is cliche-ish, and people say, "Oh, we're like a family," but we really are.
Okay.
We do things together. We go on trips together. I take care of my team because to me it's very important. When you come in, I mean, if you look at my reviews, you just go on my 400 plus reviews or so, and you look at them, and a lot of times they're mentioning my staff more than me, okay? Because my staff is so great with them.
Now, even though this full mouth reconstruction isn't a recognized specialty, but really this is a specialty type of a thing for a dentist that after dental school has to study all this stuff.
Oh,
right?
absolutely, absolutely. This is not something that you do straight out of school.
So your reputation is this complex. I haven't been to the dentist in 20 years. Broken down teeth. This is we're like right up your alley.
It's what we do. It's what I do. In my office we have 5 doctors, and my thing, all I do is the
big
full mouth
stuff.
reconstructions. Okay.
Okay, good.
I don't do the little fillings and things. I have other doctors that take care of that. Okay. That are better at it than me. In all honesty, I'm good at this.
You do the big stuff.
Absolutely.
The big full mouth stuff.
Yeah.
Time for a couple more.
Here, this is Paul.
We got about a minute left.
This is Paul. He came in. He's the one that we were talking about. That he has the money to do it. But he didn't feel like he had the time. His businesses and all that. He finally got to a point where he's retired, and he didn't like his smile. He didn't like the way his teeth looked. He came in. We gave him his plan. And he got it done, and now he's ecstatic. To he's traveling, he smiles, and again, you can see it in the before and after.
Again, he probably should have done it earlier.
A lot earlier.
That's the hard part, right?
Yep,
We all
yep.
put it off.
Yeah, absolutely.
And it's cheaper if you do it earlier.
Yeah, especially if you
It's less
consider
work.
absolutely, it's less work, and you save money.
Okay, one more. I see one more left.
One more.
I'm going to rush you.
This is Carlos, and he's great. Older guy. Actually, his son was the one that made me take care of him. And this one again was a case where he couldn't eat. Okay, if he was missing a lot of posterior teeth, his front teeth were starting to fall apart, and he came to me. We went ahead and rebuilt them completely. And again, the other day he was in the office for just maintenance work, and you can see in the smile. He's ecstatic about smiling, primarily again because he can eat. Okay,
He can eat whatever he wants.
He's a hefty guy, so he loves.
Do they tell you a lot of eating stories, these guys?
All the time.
Are they ever worried about what they're eating? Like they say, Doc, are you sure?
Yeah, absolutely. They ask me, what can I not eat? And I go, well, now you can eat anything. Before you might have to be careful, but now you can eat anything.
Okay, good. Well, we're out of time. So final message, somebody watching this, they don't know their options, but their teeth are really in bad shape. Their gums are in really bad shape. We haven't even talked about gums, because I guess you clean up the gums before you get things started.
Right.
But let's say that somebody's heard what you had to say, but they're still skeptical. They're still afraid. What do you say to them?
Just do it. You've waited this long. You don't know what your options are because you haven't been to the dentist more than likely in years. Today we have a lot of options. Just do it. Come on in. We'll give you a free consult.
At least.
Absolutely. Let's get a free consultation, and we will tell you what we can do for you, and then we move from there.
Now, I know you have a team there, but do they get to see you on the consult if they like?
I do every consult, so you will see me first, okay, and then I will put you with who I think is best fit for you.
And you have a sense of humor, by the way.
Well,
I heard your wife said you're funny too. So you have some fun in the office.
Yeah, absolutely. We're always having fun in the office.
Okay, good. So make an appointment and get started.
Absolutely.
All right. I want to thank you for coming on the show. Good
All
stuff.
right. Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.